Guys, look at this question here. Mr. Raju, he's only 20-year-old. He has come with history of fever, weight loss for a month. So this is a giveaway for you. You already guessed. Fever and weight loss for a month. Episode of focal seizures involving the right upper limb. Okay, so he has what? Focal seizures. That means a part of brain is affected. CT scan will show us a single contrast enhanced lesion. So they gave him contrast and there is a single lesion. Remember, single lesion which is contrast enhanced, which is around 20 millimeter in diameter, so pretty big, and it has irregular margins. What is the treatment of choice? Okay, so with the amount of information given, it looks something like this, right? Single contrast enhanced lesion with around 20, which is around 20 millimeter in diameter with irregular margins. What is the treatment of choice? Okay, so what will you do here? First of all, let us say that we are saying that this is a tuberculoma because he has focal seizures, and focal seizures can be because of neurocysticercosis or tuberculoma. Okay, and in tuberculoma, what they are saying is uh, the systemic problems also will be there. Like now he has fever, weight loss and all, right? So it's not just the focal seizures. Not with the focal seizures, he has some systemic issues also, right? Focal seizures plus some other conditions. But in neurocysticercosis, what you have is focal seizures. Otherwise the person will be fine. So what is the problem here? Here he has fever and weight loss, etc. Another thing with the intracranial pressure, you should know. Intracranial pressure may be raised in tuberculoma. Okay, maybe raised. Okay, that they did not give any information here, right? Anyways, so now let us write the treatment of choice. They are asking, what is the choice of treatment? Will you give steroids? I don't think so. Will you give cysticidal drugs? No, we just now told you that it's not neurocysticercosis. Will you do surgery? No. So I will give anti-tubercular chemotherapy. Okay. So you will give them what? HRZD, that is isoniazid, rifampicin, pyrazinamide, ethambutol. So those are the drugs that you will give. Okay. And then after a few months, again, you will change the therapy. You just look at the correct regimen for that. Then anti-epileptic drugs, you can give like levetiracetam and phenytoin. Okay. One thing is steroids can be added to reduce cerebral edema. Okay. But here only steroids will not work as an MCQ answer. Also guys, if there is meningitis and all, you have to check, okay? You will have to do CSF analysis, etc. Okay guys, when will you do surgery? If the anterior optic pathways are compressed, resulting in visual impairment, then you will talk about surgery, okay? Steroids, when will you add? We told you if the lesion is big, etc. Right? And then anti-tuberculous chemotherapy for 9 months minimum, they are saying you should give, okay? Anticonvulsants they have not mentioned here, but anticonvulsants you will give for 1 year along with the anti-tuberculous chemotherapy, okay? For 1 year they are talking about anticonvulsants.